Hi everyone. So is it possible that a girl below the age of 10 can give birth to an young one? So that is true. That is very true with that of the girl who has given birth to an young one less than that of the years 10 years below. So how is it possible? What are the different causes for a girl who is able to give birth to an young one less than 10 years of the age? So let us discuss in this video all about the precocious puberty. So in general, puberty refers to a time, okay, in case of a boy or a girl where she becomes sexually mature. So generally in case of the girls, it is at the age of 10 to 14 years, and in case of the boys it is around 12 to 16 years. So this is said to be a normal time where the male or a female attains puberty or they become sexually matured. So what happens when a female or a male attains puberty? So during this particular time, the GnRH, that is the hormone which is being secreted by the hypothalamus. So this GnRH, gonadotropin releasing hormone, acts upon the pituitary, and thereby it sends the signals for the pituitary to release two main hormones. One is called as FSH and the other one is called as LH. So follicle stimulating hormone or FSH acts both in case of the both male as well as in the females, where FSH in males is being generally necessary for the process of spermatogenesis, whereas in case of the females, the FSH is being necessary for growth, development as well as the maturation of the follicles. Meanwhile, the LH and another anterior pituitary hormone, so that is being acting in case of the males for the process of synthesis of the androgens, and meanwhile in case of the females, the LH acts upon the Graafian follicle and induces the ovulation. Okay. Apart from that, it also helps in the formation of the corpus luteum. So this is all about the changes which occurs when a male or a female attains the normal puberty, that is above the ages of the 10. Right. Now in this video, we will be discussing that the puberty can also occur in case of both boys as well as girls in the less than that of the 10 years. So what are the different reasons why this puberty is being seen? That is what I am talking about, is the precocious puberty occurs, and it is being regarded as it is not general, okay now, but in some of the instances the individuals attains a puberty less than the age of the 10. So what actually is a precocious puberty? Precocious puberty refers to the appearance of physical and the hormonal signs of pubertal development at an earlier age than normal. Normal, as I said, that is in case of girls it is 12 to 14, and in case of boys it is 12 to 16. So that is the normal age. But in case of precocious puberty, appearance of the physical and hormonal signs of the pubertal development occurs than that of the normal. Okay. So generally in case of precocious puberty, the onset of precocious puberty in females occurs less than the age of 8 years, and in case of the boys, the precocious puberty occurs less than that of age of 9 years. So that is precocious puberty. Now, before we discuss regarding the various aspects of the precocious puberty, let us discuss some words which are being associated. So first one is called as thilarchy, the second one is pubarchy, and the third one is gonarchy, where thilarchy refers to onset of the breast buds. So generally when a female attains the puberty, so thereafter there is a formation of these breast buds that develops under the influence of the hormones like estrogen. Pubarchy is the onset of the pubic hairs, and this pubic hairs which are being grown, so that is the first manifestation of the puberty, which means when the pubic hair starts developing, so that is the first sign that the male or a female has attained puberty. And in case of precocious puberty in both boys and girls, so there are two hormones which have been increased to their maximum. So one is called as dihydroepiandrosterone. Okay, so that is dihydroepiandrosterone. So this is one hormone. The other one is called as dihydroepiandrosterone sulfate. Okay, so these hormones are in elevated levels in both boys and girls in the precocious puberty. Next is gonarche. Gonarche is the production or secretion of the sex hormones which occurs from the gonads. Right. Now, what are the symptoms which are being associated with that of the precocious puberty? The symptoms are the breast growth, menarche in case of the girls less than that of 10 years. So commonly menarche, that is the first menstrual cycle, occurs at the age of 12, 13 or 14 in case of girls, but in precocious puberty it is less than 10 years. Enlarged testicles and penis, facial hair and deepening in the boys, that is below the age of 9 years. Pubic or axial hairs in both male and females, that is again less than 10 years. Rapid growth, acne, or it is a pimple which is being grown on the face, and adult body odor. So all these are the symptoms which are being shown by the individuals in that of the precocious puberty less than the age of the 10. Right? So these are the symptoms. So next is regarding the types. Okay, what are the types of the precocious puberty? So there are mainly two types of the precocious puberty. The first one is called as central precocious puberty. The other one is called as peripheral precocious puberty. So why we call the word it as a central? Why the word is being called as a central? Central is because if the cause is being associated with hypothalamus or pituitary, then it is called as central. Okay, understanding? So here central means if the cause, that is precocious puberty, if it is being occurring where there is involvement of the hypothalamus or pituitary, then it is called as central precocious puberty. Now, what are the causes for that of central precocious puberty? The first possible cause is tumor in the brain or spinal cord. So that is first cause. Second cause is defect in the brain, where it may be the excess deposition of the fluid. So that if it occurs in case of the brain, so then that condition is called as hydrocephalus. So what is that fluid which deposits in that of the brain? The fluid which is there, so that is called as cerebrospinal fluid, which is secreted by a choroid plexus, that is in the layer of the brain. So choroid plexus is being located and that secretes a cerebrospinal fluid. And main function of this CSF is it provides oxygen to that of the brain cells. Thereafter, it provides the nutrient to that of the brain cells, and meanwhile, it receives the carbon dioxide as well as the nitrogenous waste. So that is being done by the CSF. And when the secretion is being done, some of the CSF is again absorbed, okay, by that of the brain. Whereas when it starts accumulating, when this CSF starts accumulating in the brain, so that is one possible reason for central precocious puberty. The other one is called as hematoma. Hematoma is the non-cancerous tumor which is being grown in case of the brain. So that is the second possible reason for that of the central precocious puberty. Next is radiation or injury to that of the brain or the spinal cord. By chance, if an individual at a smaller ages, if he is being exposed to the radiation, like whenever a child is suffering from that of leukemia, in such cases, radiation is being given to treat that particular cancer. Or if the injury occurs to that of the brain or the spinal cord, then that may also result into the precocious puberty. Next is Macewan-Albright syndrome. Macewan-Albright syndrome is basically occurs because of the mutation, and this mutation occurs in case of the gene which is GNAS gene. Okay, so in this gene, if there is a mutation, so then that results into the Macewan-Albright syndrome. And this particular syndrome is a rare genetic disorder, and it is being associated with it affects generally when the mutation occurs. It affects to the bones as well as the skin color and causes the hormonal problems. So that is Macewan-Albright syndrome. Next one is congenital, means by birth, congenital adrenal hyperplasia. So this particular is also a cause for the precocious puberty, where by birth itself there is a hypersecretions of the adrenal hormones. So that also is one of the cause. And the last one is hypothyroidism, which means there is a low secretions of the thyroid hormones, either it may be T3 or it may be the T4. So these are the different types or causes for the central precocious puberty. The next one is the causes for that of the peripheral precocious puberty. Now what actually is peripheral? So peripheral precocious puberty refers to, it is the sexual development, okay, by an individual which is being influenced by the sex steroids which are being secreted from, or it is being received from abnormal resources. So when the sex steroids are being influencing, then that results into the peripheral precocious puberty, or it is also called as pseudo precocious puberty. Okay. So now what are the causes for the peripheral? First one is two sources are there for the peripheral precocious puberty. The first one is endogenous, which occurs in the body. The other one is exogenous, where the body is being exposed to various of the estrogen as well as the testosterone compounds. Either it may be the creams or they may be the ointments. So that is exogenous. So in case of endogenous sources, the first one is germ cell tumor. So germ cell tumor is where the tumor is being associated with that of the reproductive cells, which are being responsible for giving birth to that of the gametes. So those reproductive cells are being affected, or they are being having the tumor. So either in males it may be the testicular cancer possibly, or in case of the females it may be the ovarian cancer. So that may be one of the reason for peripheral precocious puberty. Second one is congenital adrenal hyperplasia, which I already told, that is abnormal hypersecretion or more secretion of the adrenal hormones. Next is the Macewan-Albright syndrome. That's what we have discussed. That is the mutations which occurs in case of the GNAS gene, which affects the bones as well as the skin color and causes the various hormonal problems. So that is Macewan-Albright syndrome. Next is tumor in the adrenal glands, or it may be in the pituitary. So possibly if the tumor is being seen in the adrenal glands, so there may be hypersecretion of the hormones takes place, or if the tumor is being associated with the pituitary gland, so there may be also possible that more secretion of the pituitary hormones may occur. Next is gonadal tumor. So gonadal tumor is also called as arachnoblastoma. So this arachnoblastoma is commonly seen in case of the females, and the gonads which are there, so they are the ovaries which are being formed, and this gonadal tumor is what we can call it as an ovarian tumor, because it is being associated with the female gonad. And when this particular gonadal tumor occurs, so there what happens is it leads, so that tumor leads to that of the development of the male characters in case of the females. So that is arachnoblastoma. Next is gonadotropin independent familial sexual precocity. So this is one of the possible reasons for the precocious puberty, as we have discussed, where it is being caused by the defect in that of the gene, which results in the production of the testosterone in case of the boys. So this basically is being associated with the boys at the age of 1 and 4. So that is gonadotropin independent familial sexual precocity, which is being commonly seen in case of the boys, right? Thereafter, exogenous, already I mentioned, when the body is being exposed to that of the estrogen or the testosterone substances, like it may be in the form of the creams or it may be in the form of the ointments. So these are the possible causes for peripheral precocious puberty. So one common thing which is there in between the peripheral precocious puberty and the central precocious puberty is, that is Macewan-Albright syndrome is common, and congenital adrenal hyperplasia is also common between these two types of puberty. Now, what are those factors, okay, which increases the child risk to that of the precocious puberty? Means, who generally can have the precocious puberty? Okay, so generally precocious puberty is rarely seen in case of the Asian continents, but it is commonly seen in case of the African as well as the American races. So that is one common thing. If you are being an American or an African race, then possibly you may suffer from that of the precocious puberty. First thing. Second thing is, being a child, that is a girl child, is one of the reason for the precocious puberty. Means girls are being affected when compared to that of the boys. Third one is being obese. When the obesity in the body at the age below that of the 10, if that has been there, if obesity is more below the age of 10, so possibly there is also a chances of getting precocious puberty. Next is when the individual is being exposed to that of artificial or synthetically sex hormones. So that is one more factor. And by birth itself, if a child has a Macewan-Albright syndrome or congenital adrenal hyperplasia, then that may also result into that of the precocious puberty. And receiving the radiation therapy to that of the central nervous system, which may result into the damage, okay, to that of the brain or spinal cord, so that also may result into the precocious puberty. So these are the factors that increase the child risk to the precocious puberty, right? Now, how to diagnose whether an individual is having precocious puberty or not? So in diagnosis, okay, so there is the first one which is there, that is called as pubarchy, as I already told. So that is onset of the pubic hair. So if it is being there less than that of the age 9.5 year, so that is one sign that a child, a boy or a girl, is having precocious puberty. Or gonadorchy. So gonadorchy means generally here I told you that the testicles will start enlarging after the maturity. But if that is being seen at the earlier age, that is less than 9.5, so that is one of the possible sign for precocious puberty. Okay, so pubarchy or gonadorchy. The second one is breast development in boys. Okay, breast development in boys before appearance of the pubic hair or testicular enlargement. So that is the second sign. The third sign is puberty, which occurs before the age of 8, or thelarchy in case of girls, that is less than 7 years. So onset of the breast buds less than 7 years. So that is one of the possible sign, and the puberty in case of the girls less than age of the 8. So that is the third one. Next one is the first menstrual cycle, which generally occurs at the age of 12 or 13. So that menarche in girls, if it occurs less than or before the age of 10 years, so that is again one of the sign to say that a girl child is having a precocious puberty. And if diagnosis is being done, then is there any treatment for that of this particular condition, that is precocious puberty? Yes, definitely there is a treatment which is being given. So that is by the help of the various of the drugs like anastrozole. So this anastrozole is basically chemical or a pill which is being taken orally. Thereafter is histrelin is an injection, and thereafter is triptorelin, thereafter is leuprorelin, or any other gonadotropin releasing hormone agonist. So when these are being given, so these all are the, what we can say is they are the estrogen or testosterone suppressors. Okay, so that is why I said GnRH agonist. So GnRH agonist, when they are being taken prolongedly, if they are being used, then there is a possibility that it may result into the osteoporosis, means to the child which to whom we are giving that drugs. Okay, if it is being prolonged for many number of years, then that child may develop osteoporosis. And stopping that of this GnRH agonist may again resume. Okay, may again resume the changes, that is basically pubertal changes will occur 3 to 12 months. Within the 3 to 12 months, again the resumption of the puberty takes place in case of these children. Now, we all have discussed regarding the various aspects, what are the symptoms, what are the causes, diagnosis, treatment, okay, of the precocious puberty. Now, who is the first or the youngest mother who has given birth to an young one? So that is in the year 1939. Okay, in the year 1939, Lena Medina is said to be the world's youngest mother, where she gave birth to her young one 7 months and 17 days. When she was at the age of 5 years, 7 months, 17 days, she, that is Lena Medina, gave birth to a young one in the year 1939. And it is being reported that Lena Medina, at the age of 2.5 years, so she had her first menstrual cycle that occurred in her body, that is at the age of 2.5 years. And she gave birth to a young one, and that was a cesarean which was being done. And what are the possible reasons why at that or how did the fertilization occur? So that is unrevealed. But she was the youngest mother, okay, and gave birth to a boy child. And later in the year 1979, so that boy died due to some problems associated with the bone. So this is all about the video which explains about the precocious puberty. Thank you.